Hello everyone, my name is Ben MacNevin from Montgomery Investment Management, and welcome to another Video Insights. Today we are comparing the public hospital system with the private hospital system in our quest to better understand the future of healthcare in Australia. Now, the following data is provided by the Australian Institute of Health and Welfare and the Australian Bureau of Statistics, and while it includes psychiatric and freestanding hospitals, the vast majority of care is provided by acute hospitals, which is where we are most interested. So first of all, let's look at capacity. We all know the Australian population is ageing, and the demand for healthcare is expected to increase. So as the population ages, is the hospital system expanding? Well, when we look at the aggregate data, it turns out there are fewer public hospitals in 2014 than there were in 2010. But the number of private hospitals has increased. There are around twice as many beds in the public system than the private system. The private system is growing beds by around 3% each year, while growth in the public system has been modest. While bed growth on a per hospital basis in the private system is less pronounced, it's clear that the private system is expanding capacity faster on an absolute and a relative basis. So capacity is increasing overall, yet how does activity within the systems compare? Well, activity is reported by separations, which is an episode of care for an admitted patient. The majority of separations are performed in the public sector, but volume growth within both systems has been comparable at around 3% each year. Yet on a per bed basis, the private system performs around 30% more separations than the public system, and volumes have better tracked capacity growth. Patients also stay around a day extra in the public system than the private system, but the length of stay has been declining in both systems, which suggests efficiency gains. Now, what we find most interesting, however, is the difference in staffing between the public and the private systems. There are nearly twice as many nurses per bed in the public hospitals compared to the private hospitals. The private system also appears to be managing nurse numbers more efficiently while it expands capacity, compared to the public system, which seems to be handling higher patient volumes with more nurses rather than more beds. So in aggregate, we feel this data demonstrates that the private system will play a critical role as the population ages and the demand for healthcare increases. Not only is the private sector expanding capacity faster than the public system, it is also handling patient flow more efficiently. The public system does perform far more emergency procedures, which requires longer patient days on average, but we consider that the private system will receive disproportionate growth in patient volumes as funding favours the more efficient operators. So thank you for joining us again, and always please follow us on Facebook and Twitter.